We are, oops. We are live. This is Senate Finance, May 1st. Happy May Day. And, oh, that's why I didn't get. Got to find out why I can't get it. It's like, pencil, my okay. So we are going to start out with H588. This is the Department of Professional Regulation, Regulated Office of Professional Regulation, and Devlin is with us. Yeah.
Thank you very much for having me, committee members. For the record, my name is Tim Devlin, legislative counsel. Let me share a copy of the bill of the button on the screen here. So this is the OPR miscellaneous bills, short handle usually is. There's not too many new fees this year as compared to some other times last year. Of note, new fees. We have an academic dentist fee, which is actually $0, but it's a good thing. We pulled out rather than just coming in. That's a fee on hand. There are, let's see, a new fee structure for massage therapy establishments and some additional fees there. And then I should say there's some statutory rearrangement, I guess is a good way to put it, where we reorganize some existing fees, moving them to more appropriate for clarity. There's really two sections of import here. One is 12A, actually that's sorry, 12. So let's do the committee. Okay. So this is their new.
Can you at some point take us through section by section?
Oh, I'd be happy to.
Yes.
Yeah, absolutely. And for the committee's convenience, I provided a full overview, which is significantly shorter and concise than the entire bill. I can really take it very high level and just do synopsis, or can provide medium granularity for really get this grades.
Medium grade.
Sure. The body of
We need to go lower.
So, this actually, in that case, would the committee prefer that I switch over to the overview rather than having one pick up here?
Sure. I mean, whatever works.
Okay.
Is this basically a housekeeping bill? Or are we doing new things?
There are, I don't know if I would describe it as a housekeeping bill. It is miscellaneous, a variety of varied changes to the powers of the OPR, Office of Professional Regulation, in general, in Title 3 is where we find those that apply to how they regulate all professions. And then we have numerous profession-specific alterations there. So I would say it's part and parcel of the it's in line with the typical nature of updates that OPR requested of the legislature every year, but I don't know if I can describe this.
Okay.
Regular.
Committee, would you like to start with the overview? And then go down there. Okay.
No problem.
Whatever keeps us inside this building longer on this beautiful Friday afternoon.
About for it.
I know a lot more about security than banking regulations.
Fantastic job, Joe.
I'm sorry.
Is anybody else having trouble with Outlook today?
What?
Outlook,
Yeah,
the
my
email?
phone. My phone
It's just like, can't type, can't.
Oh.
It's just,
My ledger account.
I couldn't get into expenses. They told me my password was where I find it.
What do you need Outlook?
Because I'm not looking at it.
Silver bill.
Well, you're working too hard.
Yeah. So, I'm going to skip the first page, which really just kind of helps. Line high, overdue, and skip right. On the new parts. So in part one of the bill, we see sections 1 through 7, we have amendments being made to the general powers of the Office of Professional Regulation. And these are located in Title 3 versus Title 26 profession specific ones. So the first kind of bucket of amendments we have has to do with how OPR will go about. This enables them to rescind licenses in certain limited circumstances. Really, you can kind of see this in section 3, where we have, oh, sorry, I should just state that the red text indicates what the Senate change from the House version came up. So rescissions, OPR will be able to rescind a license if a license was issued because of an administrative mistake, application fees were not paid in a timely manner, or essentially a compact dissolves or compact license becomes otherwise defunct. But there's a grace period enabling those individuals in practice here, have reciprocal license privileges in the state as they can do here to obtain a Vermont license in a certain time. There's 2 different procedures laid out depending on how long the licensee has had the license. The longer they've had the license, the more due process there are for this. So if they have it for less than 30 days, it's an expedited procedure. If they have license for more than 30 days, it is additional process involved. Both have appeal procedures in them for the protection of licensee. So then we move on to section 4.
Okay, just for clarity. Rescission is different than revoking.
Yes, it contemplates a situation where through various or one of those 3 circumstances that really the licensee maybe shouldn't have had the license if it was again by an administrative mistake, or it was issued but then there was a payment, so it's kind of revoked quite quickly. The one that doesn't quite fit that as well is if there's Vermont withdrawals from an interstate compact, or the compact kind of implodes because the member states.
Okay, so it's not if you lose your license in the compact, it's if the compact goes away. In order, because right now, if you have a compact license, you can practice in Vermont.
Yes,
So if you have a compact license and you're practicing in Vermont, compact goes away, you have 30 days to get a full Vermont license.
yes.
Okay.
Yes, and it also contemplates, I should add that if a compact license or privilege holder loses that credential at that home state, that they would then have to get a Vermont license as well within 30 days, but same kind of ilk. Section 4, we get to disciplinary action to be reported to the office, and this rephrases item, that was a double negative for clarity, essentially. We get into section 5. So let's do with the unprofessional conduct statutes. And this will add an attempt to fraudulently or deceptively procure a license, not only the actual success of doing that should be considered unprofessional conduct. And then it gives the director some discretion in certain circumstances where their licensee has substance use disorder or some other professional practice issues, to essentially go through like a form of emergence without necessarily having to go through the forfeiture of license determination of other procedures. But again, that'll be at the discretion of the director after the adoption of rules outlining that process. The section 6, we'll change it so that all board members must be adults.
Were there board members who were not adults?
I think they're applicants to be board members.
Really?
Apparently,
And how do you define
it's 18.
Age of
it? Okay, so it's actually about age, not maturity level.
So, section 1787, sorry. Let's see, make some clarifications to the uniform process for credential verification. Let's see, correcting some cross references, as well as some outdated terminology having to do with preliminary denial versus which we're looking for preliminary. So then we move on to the part of the bill, starting with sections 8 through 10, which are profession specific. And this bill will touch on accountants, dentists, funeral nurses, registered nurses, pharmacists, psychologists, midwives, speech language pathology assistants, and massage therapists. So we'll start off with those accountant changes. 8 through 10 will, let's see.
Removes the deep definition of good character.
Yes. Specified that has become a rather subjective criteria. And so they've opted to remove it, but I would defer to over here on what this testimony does exactly the intent behind that. The other sections
This chapter.
can be summarized by just stating that they introduced additional combinations of prerequisites. So prerequisite statement of the license by examination, additional combinations of education and experience, and what's right there providing these, I think it's 3 different options. And then updating some of the terminology from reciprocity to mobility, compared to more populous. How does it happens, kind of be weighed in or certain extent of when they don't happens. That's qualified, otherwise in other states. So moving on to part 3, dentists, this is section 512. Create a new limited academic dentist license. The idea behind this is that I think there's some interest in starting a dental school somewhere in the state. Again, for the PR, provide you details with that. This will provide a essentially a teaching license in that dental academy, and to be available to full-time dental instructors who hold a sufficient dental degree in the state, I should say, complete necessary courses and be under the supervision of somebody who's licensed in the state as well. Here's where I note that on-ball fee, it's $0. That's can be found in section 12. So part 4, funeral services. This is to change the definition of what constitutes the practice of funeral services to include providing for the disposition of dead human bodies by cremation, alcohol hydrolysis, or natural organic production.
Not volunteering to report this, but I have to ask if somebody asked me, why do we have fees that are for $0?
Yeah. We typically don't, but the way the rest of the language is phrased, it was a license 10 would be the only license in the section that there would be no language speaking to whether there was a registration or a application fee or not involved. So rather than if it's a moving question or there being ambiguity around, okay, so since OPR or something else subsequently determine what that fee is, just set it as 0, be hyperexplain.
It's for clarity's purpose, all the fees are listed in the statute, so for all the licenses, so if there was no license fee listed for this, for dental, what are they? Limited academic dental license, then I think it would be unclear what the fee is or if there is a fee. And so by putting it at 0, then it's clear that it's 0.
That's what it
My
it would
assumption-
avoid phone calls.
Right, and my assumption is the reason they're setting it at 0 is because one, there's probably not that many of these, but also they want to encourage people to do it. Because we have a dentist shortage and they're trying to get more people to be trained as dentists.
Yeah.
Ted Burnett, Director Fiscal Office is connected with a new dental school in Colchester. And so they're looking to attract, essentially, it's envisioned for dentists from other jurisdictions who are coming to teach at the school. They would need to have a specific Vermont dentistry license. And so given that the dental school will have a clinic for folks who are, receiving free or limited cost dental services, it made sense to set the fee to college. I think was the thinking there. I don't want to seem like I'm advocating for it, but I think that was the specific application of that license type.
It's in culture. We had a dental hygienist school. It was at, what was that, Vermont Tech. They asked to move to Cheney County because they couldn't get enough walk-ins for practice.
Maybe the dental therapist thing, I don't want.
We passed the dental, yes, that would allow an advanced degree hygienist to do simple billing.
But it was like, no uptake.
I don't think there's any uptake on that.
So these are new fees that we're just setting at zero.
Yes,
None of these are fees that we're bringing down to zero to make it.
correct. Yeah, it's a new fee, just a singular one, maybe set it zero. And I should just correct something I said before, speaking to eligibility for those applicants, they would be necessarily.
There's the dental therapist on the list. That we haven't, last I heard, you hadn't been any uptake that position.
So then, let's see, we're at part 5, advanced practice registered nurses, and so the requirement for APRNs. License renewal to include documentation and completion of those practice requirements. Pharmacists, let's see, this is sections 14 A through C. So 3 of those, these sections will enable pharmacists and pharmacy technicians to test for influenza, streptococcal meningitis, and to immunodeficiency virus, in addition to COVID, for pharmacists to prescribe treatment for these diseases. And so we are going, so we have psychologists, this is a team. And this will create a new session law that will enable OPRs to make temporary policies for a 3-year period regarding supplementation and educational requirements for the sexual. They call this licensure. And again, compliant and sunset, and so the required OPR to update the community for that 3-year
There
period.
is a bill in health and welfare,
Well, we already passed it.
we passed it, that would allow pharmacists to prescribe
It's correct.
rapid PEP.
Oh, yeah, no, we.
Is that, is that if we're doing this,
Oh, yeah. good question.
we ought to make sure that that goes in here.
Yeah.
These are aids, either preventative or pre-exposure or post-exposure. That was in there today. We voted it out.
I voted it out, so it's gonna be on the floor next week, but can we hear from someone in the room that seems to have information?
Christina McLaughlin on behalf of the Vermont Pharmacists Association. The Secretary of State requested that this piece be separate from what's in 611 now. And so, and we're supportive of that.
Okay,
This allows pharmacists to prescribe PrEP and PEP, whereas the insurance piece is in 611, since that's a DEBA bill.
yes,
So it makes sense to keep them separate.
okay, I just want to make sure that it's in this bill.
Yes.
Okay, because no sense updating this if it looks like that one is going to pass. Okay.
So we move down to midwives and midwifery. So this will dissolve the midwife advisory committee to the director and the commissioner of health. It will also remove the requirement that licensed midwives submit individual practice.
It dissolves the midwife advisory committee to the director, the commissioner?
Yeah.
Or they advise the director?
Yeah,
Yes,
Okay.
yeah.
And
So,
why?
yeah, advisory committee.
Why specifically are they getting rid of that?
I would refer to
Okay.
OPR.
Of course.
individual, that may be birthing centers.
I don't think so.
Yeah, I think so. Okay. We have the director over that. Okay, speech and language.
Yes, so this will require OPR to perform a sunrise review. So the suggested level of credentialing for speech language pathologist assistants on pathologists themselves. Or then we move on to massage therapists, body workers, and health professionals. And I'll just truncate that massage therapists. Or And these sections together will mainly require the registration of this massage establishments. And existing, modify the term that replaces place of business, expand the operational requirements and related professional conduct. Of note, we have fees section. That- Here. And generally say 18A is where we have most of that reorganization as well as the introduction of a new fee and structure. So a few things this does is that first it reorganizes some existing fees. So if we look at the language itself, it'll appear that there's some new underlying taxes and strikeouts. Just know that's kind of shifting it to a different section. Does not necessarily create, it's not creating new fees. And this, let's see, I find it here, text is provide that context for the community. That, let's see, moving from subdivision B to subdivision A, which will have the effect of clarifying that these fees apply to all board professions and advisor professions rather than only advisory professions. And again, for the community identification, the board profession is one. The board usually comprised of professional peers and members of the public, generally regulates the profession. An advisor profession is when appointed advisors generally assist the director of OPR in regulating. Yes,
So what are we doing with massage therapists? We're making them board regulated or making them not board regulated?
Well, this right here is introducing the fees here. I have to double check exactly which one. I don't know off the top of my head, apologies for the answer to your question, but section 18A, as well as I think two different other sections that we've amended here, introduce basically a three-part fee, not three-part fee, but three different categories of which, depending on the size of the operation, they'd have to pay different rates. So the registration fee is $90 for massage therapists, but as a reduced registration fee for the practice of massage or the practice of bodywork if it's provided by only 2 massage therapists. And then similar reduction for biennial renewal. And then here I'd like to say that solo practitioners do not have to register as establishments. And let's see, establishments with more than 2 therapists will pay the default fee of $100.
Okay, that's. Can you kind of clear what's up there?
Yes, so
All right. So these are existing fees, right? The
The
$90, the $50, $75.
the establishment fee is new.
The establishment fee is due.
Yes, and it will be different rate depending on the size of the operation. So if it's just a one-person establishment, the no fee, it's
It says, okay, so it establishes a new fee or
Yes.
fees, it looks like, for an establishment. What I'm having trouble figuring out is the $90 registration fee current? Are all of those new fees? Or are all of those,
and
then it
let me switch over.
sounds like those are new fees and then it moves fees around.
Yes,
So you've got 3 new fees or $100, 4 new fees for a massage bodywork establishment. And then it moves other existing fees around.
yes. So we gotta pull this up. Okay, so here we have 18 for modifying here. So board and board advisory. We have here
Okay, these are the new ones.
these are the moved ones that will appear because of structure. And here, you know, various ones. So if we strike limited, temporary license work permit, apprenticeship application, special endorsement system license application. And we can them over here.
Okay, about,
And then,
are these new fees and the fees that you're removing related? Or are they just separate? Separate actions in and of themselves?
they're best to be understood conceptually separate, but because they're amending the same statute, we have them kind of together here.
Okay, are the ones we're removing, are those fees that are presently on body workers, massage therapists, whatever?
No, they are, yeah, they are just limited temporary license for work permit, application, apprenticeship application. special
Okay,
endorsement.
so we are removing some fees, we are putting in some new fees. But they're separate, they're not linked at all.
No, they just
Okay,
coincide, here on the page.
right, okay,
I think my understanding is that for the massage therapist stuff, because this
No,
was,
this is a bit.
I've worked on this before, so the massage therapists we started regulating them, I think 5 years ago, and then, but now we're adding establishments.
Yes.
And so we're adding new fees for
That
establishments.
I've got, it was the moving other fees around, I'm trying to just
Yeah, I think,
figure out. You know, these are all separate lines.
right, and
No
those
red.
things that are moving are just moving to clean up the order in the statute is I believe.
Okay,
And
Yeah,
the,
they were,
it's just the only new fees are for massage therapists. and
Okay,
establishments,
that's
I think.
all I need to know.
Is that right?
Yes.
Yeah,
and so here we have the really new fee we have here for application, massage establishment, qualifying for reduced fee. That's $50. This is not new, just move from here to there.
Massage therapist licensed,
Uh,
I'm considered.
no, they are just registered right now. I believe.
Yeah.
Registered.
some people think they should be licensed. Some people may be in this room, I don't know.
Those are the emails I've got. Okay.
So they have to be licensed, but not
They're not, they don't,
registered.
they have to be registered
Not licensed.
and
So I could. Say I could register as a massage therapist. Without training.
I think there are some requirements for registration, but it's not a fully licensed profession, although I think there are many who would like it that way. Yes.
I'm sure many people.
Exactly, obviously, these things have two sides.
Yes.
At least.
That's why we do sunrise, all right. Touch
Yeah.
professionals. Okay,
Switch back documents.
there is, you don't touch. You hover.
So
Can
bring it back up.
you
Okay, so next,
similar to oriental deep relaxation, wow, something to do with dowsing. The dowsers. It's all Vermont.
so section 19A of the bill, return now to Board of Medical Practice. And this rewords, restructures the powers and duties of the Board of Medical Practice, in particular, a language surrounding how they conduct criminal background checks. And this, for the most part, brings it structurally in line with how OPR conducts criminal background checks. So the language will now look much more similar to what's OPR's general powers, specifically topic note in 3 VSA 123.
Is there any criminal background check for massage? Touch therapy?
But this is just for medical.
No, I know that's medical, but I mean. The complaints with massage. Some massage therapy that might we wanna look at.
The. So then, actually, this brings us basically to the end of the bill where we have the various effective dates in section 20. Yes, and most of it will go into effect upon passage. Dentists shall go into effect on September 1st, and then massage therapist. Language will go into effect on December 1st.
You're now about 7 minutes over. So I think we will have the direct, we will have the OPR people in before we vote this out and they're better able to explain their thinking in doing this. Is there any questions right now? Yeah. Okay, thank you. Ted, you wanna?
Sure.
One for Tim, where's your,
Yeah.
let's see a pin.
Oh, I know.
Yeah.
Rushed out the door.
Whoa.
Big with that project.
Step run it, joint fiscal office. I am going to run through the fiscal note. There is not a huge amount here. The first piece is the new establishment fees for massage therapists, touch professionals, etc. Under that graded schedule where solitary practitioners aren't paying a fee, establishments with 2 professionals would pay the registration fee of $50, the renewal fee of $75, and then establishments with a higher number of professionals would pay $100 at registration and $275 biannually. That structure would generate approximately $15,000 when those establishments first register. That would be the first year this would be in effect, and then their biannual fees, so they would renew in fiscal year 29, and that would generate $40,000 approximately at those 2 fee amounts. You would also see minimal revenue in the even fiscal years when you have new establishments coming online. There'd be a few here and there. So that's it in fee revenue. That would go into the professional regulatory fee fund at OPR. The next piece is there would be given that this isn't primarily envisioned to be a license type that would be connected with dental schools. This says OPR estimates 6 dentists. I saw updated testimony for them that indicates that the number might be closer to 20, but still, we're not talking about a large universe. And in many cases, this wouldn't be the type of situation where you would have a dentist who's currently paying the $655 fee dropping down to 0. It's folks coming from other jurisdictions who aren't paying fees per month. So we're not.
Maybe a dentist who is retiring from active practice and not renewing his full license.
Yes, exactly. That type of situation for sure. So we're not really anticipating much, if anything, in the way of fiscal impact from that provision. 2 more budgetary concerns, but want to flag them since they're fiscal and they are in the note. The sunrise assessments that OPR does for either an evaluation of adjustment of regulation of a particular profession or whether to bring the profession online can be a substantial amount of work for them. They put a lot of effort into it. These reports are hundreds of pages long. So we wanted to make sure that they checked in with OPR. They do have the resources to conduct this type of assessment through the already regulated speech language pathologist profession. So there's no budgetary concern there. And then very technically, the advisory committee on midwifery, the folks who are on that committee can receive per diem. So if you dissolve the committee, you no longer pay per diems to that.
Save money.
Yes, it's a little bit of savings. I forget the exact, it's very minimal. Yeah.
A fee is a tax, so we have cut taxes.
Fees.
No, this one has. I'm just reminding some of the members of this board, on the floor tomorrow, this committee has cut taxes today.
We're not on the floor tomorrow. Madam Chair.
Tomorrow, Sunday, on Tuesday. We're not on Monday either yet. Okay. Any questions? for Ed? Okay, thank you. I have. Ted, while you're there, do you want to tell us the fiscal note on alcoholic beverages before we have Tucker tell us what it is? Then I think I just, you did, okay.
So given, I would normally say no, and I'm looking to Tucker for his thoughts on this. Our fiscal note is very short on this bill,
Thought
and
it
what
might
you,
be.
it's not going to really steal a lot of Tucker's thunder. So I am going to.
I don't think this is a thundering bill, is it?
So pulling that fiscal note up. Really, the only fiscal impact is there is a provision in the bill that would remove the sunset on special venue serving permits. These were a new license type that would allow places like galleries, public libraries, museums.
All those places we've allowed to
Yep.
serve liquor on limited.
Yeah, on a very limited basis. These permits are $20 each. And so it contained a, since it was a new permit type, it contained the sunset for July 1, 2026. The bill would repeal that sunset. And so you would receive permit revenue beyond that date. It's exceedingly minimal. We're talking a couple $1,000s.
Okay.
Yep.
Thank you.
Mhm.
So Tucker. This is the thundering one, right?
Yes. Spring thunder,
Spring thunder.
the turkey.
There you go.
Yeah.
Yeah.
All right, would you like me to share my screen?
Sure.
Despite potential flash of thunder. Good afternoon, Tucker Anderson, Legislative Council. Gonna take a look at H 921 as passed by the House alongside an amendment from Senate Economic Development, Housing and General Affairs. I'll do a summary overview, very high level, because as Ted noted, there's really no amendments here that are directly impacting fees, taxes, fiscal picture broadly. First instance of amendment updates the terms of the Board of Liquor and Lottery. Members will serve 4-year terms instead of 3-year terms. The second instance of amendment amends the 4th class license statute. Does a couple things here. The first, there are serving limits, how much an individual can get served at these 4th class license locations. The limitations are staying in place for farmers markets, but for the tasting room and retail shop locations, it's increasing the per serving volume that can be given to a customer to what's known as a full pour, colloquially, volume for each of the beverage categories. And then finally, in this section, current statute, there is a limit at of how many of these locations a license holder can serve beverages from other manufacturers. And that is increasing from 1 to not more than 10.
Other. I guess the question is, when do you become a bar?
That has always been the question about this particular subsection of the 4th class license statute. And if the members have any questions about that, I would refer you to my testimony in the House, where I was a little more put together. Today we have fewer children.
Oh,
You have any sleep these days?
Yes.
sleep is always helpful. Especially 7 hours in a row. 4th class license, that's
License issued to a manufacturer. And
this
these,
with our, working with our local breweries, the distilleries, right? That allow them to do tastings or to serve on their premises, and then we allowed them I have a vision of someplace in Rutland that the premises was in the middle of nowhere, so they opened an establishment in town. I remember that correctly.
The fourth class license, used to have, I believe it still does, a contiguous location requirement.
Okay.
And unless we're talking about retail locations that also hold another form of license. I want to pause to just note that manufacturers can acquire multiple types of on-site, on-premises consumption licenses, first and third. So you brought up the brewers could potentially get a first-class license to serve just like a bar or restaurant.
Yeah, okay.
This is the sampling and tasting room
Okay.
type of.
And that, so this says they can sample up to 10 other, so you come there
At 10 locations,
and 10
at 10 locations, they could serve beverages from other manufacturers, and there will not be a limit anymore on the number of other manufacturers. They could be featured 7.
so they could have 10 locations. Would that locate, one of those like be a farmer's market? Where you would do a tasting? And it's 10 locations a year, or if you're at the farmer's market every week, is that one location?
I would defer to the Department of Liquor and Lottery on
Okay.
how they are constraining what a location is for purpose of the limit on the issuance of these licenses.
Yeah, I mean, we did a lot of this because these were emerging industries and we wanted to support them. But there comes a point in which they are at least adolescent, if not mature industries, and okay.
Another thing to note is that, as I brought up, there are a lot of different overlapping permits and licenses that could be taken out by a manufacturer for these purposes. So it might be useful to understand how the industry is using the fourth class license type, particularly for things like the farmer's market, when there might be other permits that could be used to accomplish the same thing. So I'm thinking specifically of the special venue permits.
Yes, all right. So what, we have this,
Yeah, so is to that point, that's why they're getting rid of the special venue permits, because it's basically redundant with some other kind of.
So, not to make it even more confusing, but that's
Yeah.
totally separate, special venue serving permit, and it's not being repealed. The sunset of the expansion of that permit, very specific. It was expanded to, that permit can be pulled out by any type of retail establishment. And prior to 2024, it could only be issued to libraries, museums, and art galleries. So
every year
the
somebody
expansion
had
to-
something else, and then it was the
Right.
bookstore. We're having a book reading and we'd like to be able to serve wine and cheese and.
Okay, so what is the bill doing? I'm confused now. It's,
For purposes of the special venue serving permit.
Yeah.
We will get to.
oh, I'm sorry, I thought you had
It's,
gone through the whole bill. I'm sorry.
It's removing the 2026 sunset of expansion of that permit.
Oh,
with
so that
any type of
anyone-
retail store.
I see. Okay, and then,
It's making it.
Restaurants should have it testing when they're showing spring season.
and then the hours, section 3,
Yes,
that's where you
Let's
are.
keep going.
Oh, okay,
Sorry.
that,
Yeah,
keep
I'm sorry, I scrolled faster than the conversation had gone.
yeah, so that's why I was confused as to where we are. So why is it, are they getting rid of the hours? It's just so you can serve alcohol at 6 AM?
So this was a very specific limit on a type of permit that was created initially during COVID
Uh-huh.
to allow first, second, and third class licenses to provide alcoholic beverages by delivery or curbside pickup as part of
You
their.
could pick up your
business model.
martini.
It was codified here, and when the COVID pieces were put in place, these were the hours that applied only to this type of license. But there are general restrictions in another statute in Title VII that relate to restrictions on the underlying license.
Okay.
So like your bars and restaurants, first and third class licenses have limited hours of sale. Those stay in place. Same for your retail locations, the second class licenses. They just won't have specific limitations on the curbside pickup and delivery. It'll fall back to whatever their general restricted hours are.
Got it. Thank you.
And you can still buy martinis in a can. 24/7.
Provided that they fit the beverage alcohol definition of a ready-to-drink spirits beverage in 7 VSA Section 2.
Yes, they probably do. Yeah, that's right.
All right. 7 VSA Section 252, this is a conforming amendment. The definition for the special event permit required approval of the local control commissioners, but the actual statute did not. So
Okay.
it's just moving that language into the statute covering the license. The notice period for retail facing permits is amended, reduced from 5 days to 1 business day of notice to deal on it. All right. Section 6 amends 7 VSA Section 271 to add a new subsection that allows malt beverage manufacturers to distribute not more than 3,000 barrels of the beverages they produce annually directly to first or second class licenses. This is direct self-distribution of 3,000 barrels or less by brewers annually. As it passed the House, there was a sunset. So Section 7 was repealing that new language in subsection G, allowing for that self-distribution. But your Senate Committee on Economic Development is proposing to just not do the sunset at all and allow this to go into statute. Section 8 removes the requirement that applied only to the solicitor's license that payment of fees for this license be made by certified jury.
Solicitors.
Happy to come back to the committee to discuss the solicitor's license.
To me, a solicitor is a lawyer. No,
A solicitor.
Like solicitor general.
yeah.
That's what.
Just to say something, that's what I think of
Oh,
a
that
solicitor.
kind of stuff.
So I asked for something.
Yes.
Things we already.
My yard. All right. Okay, I'm not gonna get it. I just, I guess, why is it in a liquor statute? Because you are selling alcohol.
Solicitor's license is for purposes of the alcoholic beverages industry in Vermont. Separate from attorneys or Georgia, so.
Yeah, all right, what do they do?
Bring up title stuff. It's a 10 out of my head, but maybe this one's faster. All right, the holder of the license may, by canvassing or interviewing holders of licenses issued under this title, solicit orders for and promote the sale of malt beverages, finest beverages, or ready-to-drink spirits beverages, and promote the sale of spirits and fortified wines.
Salesperson.
And advertising between licensees.
Okay, so this is, you should buy my wine and liquor to be in your establishment or to serve at your party or, okay. Okay, that makes sense.
Happy that I went to the statute instead of trying to work from memory and then embarrassing myself. Okay, section 9. This gets back to Senator Hardy's question. These sections remove the sunset of the expansion of the special venue serving permit.
Okay,
So the expansion to all retail establishments will stay in place. How wonderful. Okay,
and we have it because by expanding and doing away with the sunset, we will continue to collect the fee.
that is correct. There were a few amendments already noted, most of them, Senate Economic Development reduced the number of locations we discussed for the fourth class license from 10 to 5. Required reporting concerning the self-distribution by malt beverage manufacturers. Got rid of the prospective repeal of the self-distribution subsection. And then within the caterer's license, added express authority for the holder of a caterer's license to serve alcoholic beverages at a location that is located on premises that the holder of the license has another license for. Solving an issue apparently where licensees who hold a first, second, third class license also have a caterer's license.
Yeah.
Are prohibited currently by the definition of the caterer's license from catering events on their own property.
Wow. Okay. Great. Yeah, because usually. Yeah, it's always. All right. Committee, do we have any questions? This is here because of doing away with that sunset. The fee revenue will continue to come in. We'll get a few more $20. We'll get a few more $20. You can pass that to the clerk.
I would move favorably draft number 1.3 of H 921 as received from the Committee on Economic Development, Housing and General Affairs.
Okay. Senator Chittenden has moved favorably 1.1. Yeah. H 921 as not relating to alcoholic beverages as it came to us from the Committee on Housing and General Affairs. Any further discussion? Are there any amendments? If not, all those in favor say aye.
Aye.
Oh, all those opposed say no. That's 700. You can check off everyone's name who would like to report that.
Did you report?
That's right, you both there, so you know. Okay. No problem with that. Okay, committee, we're on a roll. Wow. Our next witness is our next witness. We are on fire. We are on fire. There's the committee's on fire. There we go. We are on a roll. We are fast. So, whoa. There's more people than here.
Well, we're in a suit. We're in a vest. Yes.
Okay.
We're gonna be there.
You guys want to walk through first, or do you want to hear from the treasurer first? Let's hear from the treasurer first. Don't know this was gonna take a very detailed walk through. Yeah.
Okay, thank you.
Okay, well, whoever is running the. Some of us have seen this before.
It's a good pressure.
Okay. And you can look this up online. I have done it.
Yes.
It's not Canada Pharmacy yet.
It's quite accessible.
And there was a significant difference in the price of the one drug I looked up. It's right between my 3 local pharmacies.
Personally, no, that's even service.
It's the same way. We should go.
Well, that's the same letter.
Okay, let's go. We're a little rowdy. It's Friday. You've been here till 6 o'clock. It was nice.
Charlie, would you mind sending the Zoom link, please?
For the record, David Chair, Deputy Treasurer.
Peter Trombley, Director of Legislative Affairs.
Okay.
So I'll turn it over to Peter, our Director of Legislative Affairs, in a moment, but just wanted to open and he'll give an overview of the program and how it operates and some of its benefits, which we believe are significant. But just to start us off, wanted to know that this is a top priority for Treasurer Pete Jackson. Sorry he couldn't be here himself today to talk about it, but I wanted to make sure to convey that message. Obviously, as we all know, healthcare costs are a really significant challenge in Vermont. They're a real driver for a whole number of challenges and costs that we face as a state. ArrayRx, as you can see in the letters that Peter handed around a minute ago, really has an opportunity to make a concrete dent in some of those costs. And we think that in an area that can be very challenging to wrap your arms around and make a real dent, this is an opportunity to lower costs for Vermonters. If there were just 1% uptake over 1% uptake in Vermont, and we see the same savings that folks are seeing in Connecticut right now, that would be $20 million more per year back in Vermonters' pockets. So, and we can start with the presentation here, but just reiterating the point that I made a moment ago about how significant healthcare costs are. Prescription drugs are a major driver of those costs. And I'll turn it over to Peter to take it away with the program.
So what we are proposing is for Vermont to join a multi-state collaborative known as ArrayRx. ArrayRx runs a variety of programs. One such program is this discount card option that can be made available for free to any resident of a member state. And that is the specific program we're looking to join in the Treasurer's Office. ArrayRx was founded over 2 decades ago by Oregon and Washington. And the discount card program has been operating between those states since I believe 2005 or 2006. And since 2023, they've been expanding it to other states. Recently, Arizona, Nevada, and most recently Connecticut have joined as well. The basic vision behind this sort of collaborative is that states, when working together, can achieve things that they simply can't alone for all of their constituents. A few features of this discount card program: there's no cost to Vermonters to enroll. You don't pay a fee when you sign up or any ongoing annual fee to be a member of the discount card. There's incredibly broad coverage for all FDA-approved prescriptions and several over-the-counter items as well. The savings average up to 20% on brand name drugs and up to 80% on generics. It's accepted at more than 65,000 pharmacies nationwide, as well as the vast majority of pharmacies in Vermont. There's very transparent online tools that Vermonters will be able to use to look up pharmacies that accept the program and what price they would pay for different drugs as those pharmacies. It's a very privacy-focused model. There's no selling of consumer data, which is something that we see quite rampantly in the private sector alternatives and those discount cards business models. It provides, really significant support for individuals, particularly if they're, have a gap in their insurance coverage or a lack of coverage for prescription drugs in particular. And the pricing model is designed to be much fairer to pharmacies and many of the private sector alternatives. And the governance structure is designed to balance as many interests as possible. So how would the program administration work? Well, the ArrayRx collaborative will handle much of the day-to-day administration of the program. They negotiate contracts with the pharmacy benefit manager that manages the program and with the nationwide pharmacy networks. They operate a customer service email and a phone line for Vermonters who may have an issue with the card. They actually administer the cards and verify eligibility and distribute them. And they maintain the IT and data security. Who is actually doing that work? It's public sector employees of the Oregon Health Authority, whose salaries are in part funded through the ArrayRx program. What would our office be doing? We would be, driving outreach and awareness of the discount card to make sure it's actually utilized, developing partnerships with on-the-ground entities across the states and make sure that they are getting it out into their communities, and participate in the steering committee that governs the collaborative, its budget, its contracting process, et cetera, looking out for Vermont's interests and Vermonters' interests in this program. How is the program funded? Why is it in your committee? The program is funded by a simple fee model where there is a small fee baked into the advertised price of the drug. So if you are a consumer and you see that a drug is going to cost you $10 at your local pharmacy, that $10 includes a small amount of money that is remitted in that transaction up to ArrayRx. It is used to cover ARX's operating costs, according to the budget that the member states agree on. And any remaining funding left over at the end of the year that is not needed for the operating budget is redistributed back to the state, which we would receive in a special fund. Like Jen Carvey, Nolan will walk you through that in the text of the bill. And we would be able to use this funding to offset program costs. For us, it's really about, whatever paid marketing we're able to do for the program. We anticipate that this fee revenue to be minimal. Connecticut, much bigger state, far more users than we're likely to have. They receive in the thousands of dollars a year. And that's because the fees are really set just to cover the costs of operating the program. They're not trying to generate substantial revenue out of Vermonters in these transactions.
You keep saying small fee. Like, are we talking $10? Are we talking about pennies or
We're talking in the few dollar range for most transactions.
so a couple dollars for any transaction or like is it you have a $10 prescription, is it $2? And if you're $100 prescription, it's $2 or
The fee is static, but always less than the discount.
okay.
So how does the card work? You can visit ArrayRxCard.com. You can sign up, you can enter your name, your date of birth, and Vermont address, and then cards can be delivered to you instantaneously by email or by physical mail if you would prefer. They tell stories about folks arriving at the pharmacy, going up to the pharmacy counter, either remembering the program or being made aware of the program, pulling out their phone, signing up, and having the card to use that transaction right then and there. So it's incredibly fast and efficient. On the website, you can use these tools to find pricing for the specific drugs that you utilize, and how those prices differentiate across pharmacies. You can see whether your pharmacy participates in the program. The vast majority in Vermont do. So here's an example. This is a tool you could use to find your prescription. So say you're trying to find some Atorvastatin calcium tablets. You would look up the drug. You would see on this map, these pins are each representing pharmacies that accept the card, and you can see the pricing at various pharmacies. This is some data from ArrayRx that shows some sample drug price differentials. So you see on the left here the name of the drug, the formulation of the drug, and what the average cash price for a 30-day supply would be, what ArrayRx's average retail price is for a 30-day supply, and over on the right, what ArrayRx's average price is for a 90-day supply. So you can see some really substantial savings for these commonly used drugs. Atorvastatin is what I was looking up in the previous slide. You can see average price $9, cash price $32. So who does this card benefit? Well, anybody is allowed to sign up for the card and can check on a case-by-case basis whether it's going to save them money on certain drugs. But there are a few groups that we think are particularly poised to benefit from this program. Uninsured Vermonters, those who lack coverage of any kind. Unfortunately, I think we're really concerned with premium rates rising if they have been, that we're going to see more Vermonters foregoing insurance. Underinsured Vermonters, those who have really high deductible plans, limited coverage for prescription drugs, who are very much exposed to month drug costs. That's about 31% of the state, we estimate. Seniors without any pharmacy coverage, we saw, as I'm sure you all watched closely over the last year, the Medicaid Advantage market largely collapsed throughout the state. We were very concerned as we were vetting this program that there may be a lot of seniors who in that transition failed to pick up prescription drug coverage. And if your insurance does not cover a specific drug, so a class of drugs we can think about a lot when we're having this conversation is GLP-1 drugs for weight loss, which insurers are largely pulling back from covering unless diagnosed for specific reasons. But, for anybody, there could be a case-to-case example, even if you have insurance, where this card will offer you a better deal. So here's a couple sample constituents. This is some, data we could find on pricing and data we found from ArrayRx and what it might cost for various hypothetical individuals. So this is a young woman who has a really high deductible bronze plan. She, pays a lot out of pocket for drugs. She takes sertraline generic as well as Adderall brand. It's a very expensive drug to be picking up without coverage the brand medication. And you see here, if she's taking these two drugs and paying cash versus paying for ArrayRx, she might save about $153 a month. Here's another example of a senior Vermonter who has no pharmacy coverage. They take the 3 very common medications for seniors. They try to find the cheapest available option they can, 3 generic medications. So they're already not spending too much a month on drugs, but even with ArrayRx, they could save another $50 a month. And this is an individual who perhaps his insurance used to or never did cover GLP-1s for weight loss. They want to use the medication for weight loss. It is simply unattainable at $1,000 a month retail price without insurance, but with ArrayRx, it's still expensive, but maybe within budget for this individual, it could save up to $820 a month. So the legislative journey of this legislation to date passed out of House Healthcare 11-0, made its way through that body in a favorable floor vote and was voted out, I believe, last week, Senate Health and Welfare 5-0. And of course, there are folks in this room who can test me on that. I'm happy to answer any questions now, but also want to put contact information up for myself and Deputy Treasurer Scher, who opened this up today. Always available to answer any questions.
You may not remember, but what was the reason given to by the no voters, you know?
So happy to talk about that. When we first presented this option, there was a mixed reception from small independent pharmacists. We had a couple small independent pharmacists come forward and said they really liked the program. They wrote letters of support, which we can make available to the committee. We had others concerned that it may eat into their margins because these private sector alternatives quite often do aggressively. We've been in a lot of dialogue with those pharmacists. We've had a number of conversations. I don't believe they testified in opposition to the bill in the Senate. And there are a few reasons why we think that this is a good policy for Vermont and the right balance of interests. I mentioned before that public sector governance model and why that was so important. When we talked to pharmacists in Oregon who've been using this card for over 20 years, they pointed to the fact that, they are represented on the ArrayRx steering committee by public sector officials who care about pharmacy networks and pharmacy access just as much as they care about consumers. That's not the case in private sector alternatives. So we have absolutely no incentive to try to balance the needs of pharmacies. Another important thing to consider in this program is that nothing in this bill makes this program mandatory for pharmacies. Nothing in this bill requires them to contract with the PBM who manages the card. Most already do and would accept this card if you brought it from out of state. But there's nothing in this bill that makes you, nor is there anything in this bill that requires you to process a transaction or fill a prescription, even if you do contract to accept the card. So it's entirely optional for pharmacists. And for those reasons, it's important.
So it's, I can sign up, I could go home today and sign up for this card.
That is correct.
Okay. And the state's not involved at all, right? So I understand it. Okay.
Oh, so excuse me, sorry. At the moment, you would not be able to sign up. If we pass this law, you would be able to.
So I can't sign up for an ArrayRx card or right now.
Not in the moment.
Because I live in Vermont.
Yes. Because Vermont's not
Okay.
a state.
So this bill solves that.
Yes.
Thank you.
Yeah, I've had experience with this kind of program before, and there are probably 10 or 11 different cards that are available that provide various levels of discount in Vermont. And there was a time 5 or 6 months ago when I was trying out those cards versus my private insurance. It's the typical United Healthcare, Medicare plan for prescription drugs. And what I found is I could buy my prescription, most of the prescriptions I had, for almost 50% of what that discounted Medicare prescription drug card would cost me. And those were available just over the counter without doing anything about signing up. This is everything from GoodRx to those types of programs that are available in Vermont. Problem is people don't use them. One of the reasons people don't use them is that there's not an easy computerized way to find the cost of the drug that you want. You have to get it from the pharmacy because the pharmacy has the computer lookup to be able to look up the drug. That's one. And two, pharmacies are annoyed. They don't like to have tons of people come in and everybody asking for all of the discounts that are available to us. That's one of the major problems that we have. Whether we could solve it legislatively, I don't know. This program, I'm assuming you have the ability to find out what the cost of your drug would be versus the cost of any other insurance that you have. That's a major, major advantage.
I just looked up Lisinopril just before you did. And it's right there. It tells me where my pharmacies are. There was a significant difference in price between pharmacies. So it allowed me to shop around. Not if you're a senior who doesn't do computers, which are getting to be fewer and fewer, you would have a problem. But I could do that. I'm not sure what where I'd find out what my insurance covers. But
Talk about a transparency bill.
But the numbers I got were, I would say, lower than I've been paying on my insurance.
You're quite right, Senator. And when we were vetting this proposal, we encountered the same problem that it can be really hard to find out how much a prescription drug costs. And we were, going through that process as we tried to figure out how much would people save if they use this card. And one of the reasons we like it is the, real price transparency for consumers. Yeah.
Big difference.
Average wholesale price is known fondly as ain't what's paid. To try and find out the actual cost of any pharmaceutical is virtually impossible. And I think we spent 2 years at least in this committee working on pharmaceutical prices. Did one thing with data mining and lost gloriously, I'm told, in the Supreme Court. And I think, but yes, it is the most frustrating thing to deal with. And if you want to get really frustrated, go online and look at Canada Pharmacy and their prices.
You don't know what to do.
And the one I looked up, because my husband just said a new drug, so I know what he pays online. It was the lowest price here was double what I could get on ArrayRx. But that's this country versus the rest of the world.
Yeah, can I ask a question? So I missed the beginning of your pitch, but this is you use this card instead of your insurance?
Yes, that's a very important detail. When we introduced this legislation, no state allowed you use it instead of your insurance. It's an entirely different way of processing the transaction. And no state today had allowed money you spent through this card to be counted towards your deductible, although Connecticut is in the process of making that change. House Healthcare Amendment Bill and has made it so that if you have insurance and you get a better deal for ArrayRx, you can buy the card for ArrayRx and file a claim online against your insurance company. And the money you spend with ArrayRx will be counted towards your deductible.
Okay.
Not this, does this bill do that? Yes, this bill does that.
Okay.
It can count against your deductible.
And I'm just looking it up as you guys were talking, but this is essentially a public consortium of states. It's not a private. There's not there aren't investors behind this that are making a ton of money off of all of us.
This is a collaborative of states. You're quite right. 5 states to date: Oregon, Washington, Arizona, Nevada, Connecticut, actually Ohio as well, though they have restrictions.
And is there red and blue?
And the staff work, the actual administration is done by public employees of the Oregon Health Authority, whose salaries are funded in part by the ArrayRx budget, which comes from the fee revenue paid through transactions. And the oversight of those staff and that budget and the contracting process is done by the steering committee of member states, of which Vermont would be a member if we were to pass this legislation.
Got it. Okay.
It's entirely public sector.
Is there, it hasn't been any negative experience with other states in which private insurers that are now also in business, depart those states or raise prices those states or do anything else that is anti-consumer as a result in order to make up the profits that they lost through what Array is doing.
We haven't, we didn't hear from any of the individuals we spoke with in any other states about issues with their insurance markets.
Change.
We, Blue Cross Blue Shield testified in support of the legislation. Cigna sent in a letter of support as well, if I'm calling it correctly. At least we spoke to them. And that's because it actually can reduce their costs, because if somebody who is a member of those insurance companies is using ArrayRx, it's because you're getting a better price, a lower price. And you can look at some pretty clear scenarios where if you're have major savings, even though that's still counting against your deductible, it's if you're on these high prescription medications, maybe you hit your deductible early in the year after paying sort of prices out of pocket. That's a big loss for an insurance company. And if that individual can find a much cheaper alternative with this card, it's a benefit.
Okay. Do we have any more questions for the treasurer's office? We'll let Jim walk us through really quickly, and we'll let Elvin give us thing, and our COPR is here, so maybe we'll get to hear from them.
Thank you for your time. The very final thing I'll mention is there's
We're on a roll voting things out. So
district level projections on here. And those we
get
have.
to. I don't know if we're gonna get to 753 or 385 today. I'll
Since open this motions.
see, but yeah, okay. I think we're on a roll, Janice.
Great. Good afternoon, Jen Harvey from the Office of Legislative Counsel. Queued up and ready to go here. So we are looking at H 577. I'm mostly showing you the bill as passed the House because the amendment from the Senate Health and Welfare Committee is pretty minor, but I'll show you that in a moment as well. And I'll just give you the high level version. Section 1 establishes the Vermont Prescription Drug Discount Card Program and an existing chapter on prescription drug cost containment. It has it administered by the Office of the State Treasurer. It describes some of the parameters that the Treasurer's Office went over with you. It has the monies that are received by the program from any source goes into the what gets retitled the Financial Literacy and Economic Empowerment Trust Fund. As introduced, the bill would have created a new special fund for the money to go into. The House Ways and Means Committee wanted to use an existing special fund, so we expanded the purpose to reflect some of the other activities by the Treasurer's Office. There's language that refers to this idea of the amount paid for a prescription drug after using the card by someone who's covered by a health insurance plan being attributed toward their deductible and out-of-pocket responsibilities. And the next two sections of the bill amend the insurance and pharmacy benefit manager statutes to make that happen. And it requires an annual report starting in 2028. You'll see there's a one-time report in 2027 as well, but detailing the activities of the program during the previous year, including how many Vermont residents and pharmacies participated and what the savings was on the drugs. And this is where the Health and Welfare Amendment comes in, so we'll look at that again in a moment. Section 2 is the health insurance statutes provision, doing the actual change to ensure that the amounts paid on behalf by or on behalf of the covered individual, including through this prescription drug discount card, would be counted toward their out-of-pocket responsibilities and deductible under their plan. It also requires the health insurer or pharmacy benefit manager or both to make readily available on their website a downloadable proof of payment form and provide notice to covered individuals at least annually that they are responsible for providing the proof of payment if they paid out of pocket without using insurance, to ensure that the health insurance plan can properly attribute their spending to their out-of-pocket responsibilities. It also gives the potential for them to use an online mechanism that isn't just a downloadable form. Section 3 is the same language or similar language in the pharmacy benefit manager statute. And then section 3A amends the financial literacy and now becomes an economic empowerment trust fund. So a lot of it is just updating the name and expanding the purposes beyond the existing purpose about financial literacy to also support other economic empowerment opportunities for Vermonters. And referring specifically to the funds being available to defray costs associated with administering the Vermont Prescription Drug Discount Card Program. Section 4 has the one-time report due by January of 2027 on implementation of the program, including any recommendations for improving program administration and an estimate of the projected cost to the state in the event that additional financial support is determined to be necessary to support the program. So if there is found to be a need for additional funds. Section 5 appropriates $50,000 in fiscal year 2027. I believe it's included in both House and Senate versions of the budget to the Office of the State Treasurer for costs of developing and implementing the program. And the act would take effect on July 1st. And then there are questions on this, I'll answer those and then pop up the health and welfare amendment.
Section 5 is in the budget.
It's
Yes.
the budget, right?
Yes, okay.
The chair of health and welfare is on appropriation.
Yeah.
Good question. I was gonna ask that too.
You never know.
And then here is the brief amendment from Senate Health and Welfare. This does two things. The first is to take out that annual report requirement briefly in order to make a change. And the change and put it back in with the change. So the change is adding to the annual report the impact, if any, of the program on the viability of Vermont's pharmacies. So there had been some concern about whether there would be a negative impact of pharmacies, so that would be part of the annual report. So they would report annually at least the number of Vermont residents and pharmacies participating, amount of savings on prescription drugs, and the impact on the viability of Vermont's pharmacies. And the second is just adding in a missing word in one of the sections that was reference to the drug discount program without saying drug discount card program. So fixing that. I see that.
I guess question for the treasurer's office. Is there anything that prohibits independent pharmacies? Or maybe the Vermont Independent Pharmacies Association from joining this? Do you have to be a national chain?
Peter Trombley, Office of the State Treasurer. You do not have to be a national chain to, be a part of this program. The vast majority of Vermont pharmacies already accept a RareX card, so someone from out of state were to bring one. But there's also nothing in this bill that requires them to enter into a contract to accept it, nor even if they have a contract are they legally obliged to fill a prescription if they feel like it's not doable for them.
Okay. So.
Probably also a question for the treasurer. How long will it take you to set this all up if this bill were to pass, and when can Vermonters start taking advantage?
I mean, the biggest holdup will be the state's contracting process because we have to enter into a legal contract with the RareX Collaborative. Our hope is to have that done by the end of this year so that it can be launched sometime late 2026 and be up and running as soon as possible. But that's the real barrier. As soon as we've got the contract in place, folks can sign up instantaneously.
Thanks. I don't know if this is a question for Jeff or for Peter, but I'm looking again on their website and there's a steering committee. Does the bill say who is our representative on the steering committee?
The state treasurer would have the authority to appoint the steering committee member for RareX.
Is that in the bill?
No, but the treasurer's office administers the program under in the bill.
Oh, okay.
Okay, we're ready to hear from Nolan.
Yep. No.
Okay, thank you, Jen.
Sure.
Nolan. Tell us we're gonna get rich.
For the record, Nolan Lang, Joint Fiscal Office. To steal a line that has been used in the legislature, and I earlier today, I think everything about this has been said. I just haven't said it yet.
Okay.
Which is, yes, basically there's $50,000 appropriated. It's in the budget construct. The treasurer for getting the word out, the
It's
advertising.
advertising basically, isn't it?
Yeah.
Getting the word out to people.
What we heard is the success of the program depended on people knowing that it's there.
Yeah, right.
So, the other thing I'll just flag, this went to Ways and Means on the other side initially because there was some language that was taken out about the treasurer having the ability to raise a fee. Ways and Means took that out. I know that's not why it's here. It's here because you guys cover insurance, so just.
Okay. Any questions?
Was it, but yes, actually, was the fee to cover the costs and instead they went with an appropriation or what?
The fee,
You want me to answer that?
yes,
So there was language allowing the treasurer's office to impose a fee if a fee was determined to be needed. And as more information was learned about the program, we learned that the fees are included as part of the amount the patient pays. And so there was no fee amount needed to be established. And so that also assuaged concerns about whether to delegate the legislature's fee setting authority, et cetera. So
Okay, so
we didn't need to address it.
if the fees are embedded in the program, they're embedded in the amount that the consumer pays. How is there transparency on what those fees are anywhere? We talk about them.
Turn back to Peter on that.
Okay,
If I may, and I'll note that it was never our intent for our office to be setting a fee separate from the fee existing in the program. We proposed a language that we thought was necessary to make that doable, and then more narrow language was viable as well. We were happy to support that. The exact value of the fee is not typically disclosed because it is negotiated in a competitive marketplace against other private sector alternatives.
it's a PBM fee.
It is a in the couple of dollar range, always smaller than the discount provided and always baked into the price you see on ArrayRx's website. So if it tells you the drug's gonna be $9 at Kenny Drugs, it's gonna be $9 at Kenny Drugs. It's not gonna be a fee added on top of that.
Okay,
So you know going in, if your fee is bigger than the fee,
then what you
the
could use
pharmacy
for your,
next door.
or that what you could get with using your
Right.
health insurance, yeah.
I still don't know how to figure out. health insurance.
One of the things, when you go to a pharmacy, to buy a particular drug, the fees do vary presumably because they're embedded in the price that you actually pay. And with Array, do you find that you're paying in effect a standard fee for each prescription, or the prescription, the fee varies depending upon the total cost of the prescription itself?
My understanding is that the fee is standard and the price variance between pharmacies is due to the negotiations with the PBMs. And not the fee varying on the ArrayRx's end.
So then you still have, do you then have part of the fee, the price that you're actually paying, the fee that Array is charging, the fee that is there, I assume there's a PBM involved somewhere, as well as the fee that ultimately gets paid to the company that is the manufacturer or producer of the drug. So there are three parts to the fee, is that correct?
There are two parts of the fee. There's a portion that goes to the PBM that administers the program under the direction of the steering committee. The PBM is called Navitus. There's a portion that covers the ArrayRx costs, so largely the public employees in Oregon who are administering the program, the legal fees for contracting.
By the PBM, you're saying that in effect that Array has a PBM that is as opposed to the intermediary that Kenny Drugs or Walmart and so on are using.
Yes.
So they're using separate PBM. Okay.
Yes. That PBM takes a piece, Array takes a piece, whatever's left over is returned to the states.
Okay.
Okay,
If I'm speaking.
ready for a motion? Do we need more testimony?
I would favor of the H 577 as received and amended from the Senate Committee on Health and Welfare.
Okay, Senator Chittenden has moved that we approve. What is the number of this one? H 577, as we received it from the Committee on Health and Welfare. Is there any further discussion? Are there any amendments? I'm gonna do this. All those in favor say aye.
Aye.
Opposed say no. That's 700, so you can check all our names. Okay, we're on the roll.
gonna take this one.
Order.
Let's see. Okay, I don't have,
Madam Chair.
what, order. Yeah. Okay. Are you doing it for health and welfare? No. No. Jenny? Jenny's doing it. Okay, yeah. Dan, do you want to come up and maybe we can get the OPR bill out? That would be perfect. Thank you. I think we just weren't totally clear. Midwives then. Well, yeah, exactly what was happening. So wanted to just give you a chance to answer some questions and maybe help us understand what is going on. So that we were working primarily off of the overview. Is that the best place, or would it be better to just do a quick 2,000-foot section by section?
Whatever works best for you. I don't have the overview up in front
Okay,
of
so
me.
then why don't we just do a section by section, and you can tell us what you were doing there, or
Okay.
what to do there. And we have draft 4.1, I assume it came from the House.
Okay, well, I have a draft that's 3.1 dated for 2026, but I don't think there was much change after that. So
Okay.
I'm happy to go ahead and, for the record, Jennifer Colin, I'm the director of the Office of Professional Regulation. Good to be with y'all today and happy to answer any questions as we go along. So, in, section 1, basically, we're adding rescission to the authority of OPR. Sometimes we have to rescind a license administratively because we pushed the wrong button in the system and inadvertently issued a license, or somebody paid a fee and the check bounced or something like that. So
this is not quite as like revoking a license.
It's
for
not legal
malpractice.
that's
This
correct.
is a technical, we're gonna rescind it.
That's right.
And
And so we give, if they've had the license for less than 30 days, there's a notification that we're rescinding, and then we rescind, and then there's an opportunity for them to ask to be heard in front of a board or an administrative law officer. So, you know, there's due process when it's less than 30 days, or if they've had the credential for more than 30 days, there's more due process. We give them notice and an opportunity to be heard before we rescind. So, you know, that's built into this change, and, you know, it's an administrative.
Rescinded because you didn't pay your fee
That's
and
right.
you came in and paid your fee.
Yeah, the most recent example I have is, we inadvertently issued someone, an RN license, just prior to them graduating from school. So they had another credential from us, but they hadn't quite finished up the RN work.
So you rescinded it and said, when you finish your classwork.
That's right, and we'll turn it back on. And that person did request to be heard in front of the board. The board listened to their request and said, we're gonna wait until you graduate and finish your course.
Okay, so she did try to get
Not
kind
a
of
nurse yet.
they got kind of a jump on the system,
That's
figuring,
right,
I'm gonna go to work day one.
that's right,
Okay.
yeah, so, then section 2. Also deals with this rescission process, and section 3. So I'm happy to go through that in greater detail, but I think you guys.
That's really not.
Okay, great. Okay, section 4, we made a small change to the mandatory reporting requirements for healthcare facilities. Just, we changed a double negative to a positive so that it's just a little clearer for facilities what they have to report to our office when someone engages in unprofessional conduct, when one of their licensees. Okay. Section 5, we made an attempt to. Oh, section 5. Sorry, I'm just getting across here. We made an attempted fraudulent procurement and unprofessional conduct. Right now, fraudulent procurement of a license through misrepresentation is unprofessional conduct. But now we've made attempted unprofessional.
I tried to buy it, but it said, no, we don't think so. So I failed. So I
You failed, but you tried to do something.
tried to do something bad.
That's okay. Section 5 also references the authority of the office to create, through administrative rules, a program offered for people with credentials from our office to enter into alternative to discipline programs. So right now we have this in nursing, we have what's called a practice remediation program, where if someone makes a mistake at work that doesn't quite rise to the level of unprofessional conduct, but is a problem in their practice, they can go through this program, take coursework. There's no public ding on their license, but it just ensures that they understand what the problem is. That's right. And so we don't offer this for people who have engaged, had multiple instances of this. It's kind of a, you made this one mistake. Let's correct it. And then the other thing we want to have, which we also have in nursing, is a program where if someone self-reports a substance use or alcohol issue to the office as a practitioner, and they want OPR to do some monitoring of them, where they have to have UAs and get substance use treatment, we can monitor their progress through a program. And it's really an accountability measure for someone who wants to make sure that it's not impacting their practice.
Okay.
So section 6, we want board members and advisors to be the age of majority. That's pretty simple. Yeah.
We've heard that you had people applying who weren't of the age.
We had someone who was a high school student who was interested in a profession and wanted to be on one of our boards as a public member. And we deal with a lot of serious topics, and there's an ethical oath, and there's confidentiality involved in what we do with our
under 18.
So it just didn't.
Yeah.
So we just wanted to clarify that law.
Yeah.
Section 7 had a reference to a preliminary license denial process that we actually changed years ago. We no longer have a preliminary license denial process, so we just needed to remove the word preliminary. And so that's just a little bit of a cleanup. Section 8 has to do with accountancy and mobility for CPAs across jurisdictions. And that national mobility is something that already kind of exists in the CPA profession for CPAs. So we wanted to recognize that this section also has an additional pathway for folks to become CPAs. So the changes allow for folks to be licensed if they have a post-bachelor's degree with a focus in accounting plus 1 year of experience, or a bachelor's degree with a focus in accounting and 2 years of experience. Right now, you have to have a master's plus in order to get a CPA, and you have to pass the exam. So the coursework that's required is beyond a master's degree. So this removes some unnecessary barriers in that profession. And our understanding is that there is somewhat of a CPA shortage. So this is being done nationally so that folks can have greater access.
The auditor has a question.
Just curious as to why the good character is taken out of that.
Yep. So we're taking the good character provisions whenever we open up chapters that have that, we remove that because we already, when someone applies for a license, they have to disclose to us their criminal involvements and their criminal history. And we go through an analysis of is that criminal history related to the practice of the profession? Is that something that the public needs to know about in order to be safe with respect to this practitioner? So we already kind of go through that process. It's baked in. Jurisdictions that have good character provisions are kind of moving away from that because it's a very subjective standard.
I thought you were just doing it to accountants specifically.
No. Whenever we open a chapter,
Which I can
something
understand.
like that, nope. We have different ways of looking at that instead of a subjective. It's good. Okay. Yeah. Section 11, dentists. So there's this limited academic dental license. I heard you speaking about that earlier.
Yeah, we did.
And it's a 0 fee, which you made the great point that the reason we have that in there is because if there was no fee, people would be wondering, am I paying the regular dental fee,
I
so
did call you.
yes. So rather than get those phone calls, we just wanted to make it real clear, there'd be zero fee. Section 13. Section 13. Patients as I kind of flipped through. Yeah, funeral services. So we just wanted to clarify and we had some questions in our office about whether alkaline hydrolysis and natural organic reduction of human remains, if that was kind of part and parcel of the practice of you.
Hydrolysis.
I just looked it up. It's pretty wild.
It's just in simple terms, and I'm sure there's a
Okay.
greater technical way to explain it, but it's basically cremation by water.
I'm going to a burial at sea. Is that alkaline hydrolysis? No.
No. But yeah, alkaline hydrolysis, rather than traditional cremation, which
Yeah.
puts particles into the atmosphere and is like
Oh,
it's
okay.
more
All right.
environmentally friendly. It's not.
It's,
That's right.
It speeds up the decomposition.
all right.
Okay.
Don't think too much about it.
Great.
24 hours.
Section 14.
Wow. Keep going.
Thank you.
It's Friday.
Yes. So section 14 for APRN renewal, we are removing the active practice requirement. So APRNs have national board certifications, much like physicians do. And those national certifications require them to have a lot of continuing education. And that's the way we measure their ongoing competency. So to have an active practice requirement, it's, we're moving away from that. And it brings it more in line with what's required for RNs and LPNs and other professions. So, so that's that change. Pharmacy, section 14. Okay.
Oh, this is the yeah. This is the one I want to make sure, since we're allowing pharmacies to prescribe PrEP and PEP.
Yes.
While we're changing this, if that is, because I think that's gonna go through, I haven't.
Yes, that is in here. So, so section 14A, we have a pharmacist can prescribe pursuant to state protocol that's created in collaboration with OPR and the director and the commissioner of health. That allows pharmacists to prescribe certain medications. So section 14, let me just turn to the right page here. So allows 14A for patients at 18 years of age or older, medications for the prevention of HIV virus, including those for pre-exposure and post-exposure prophylaxis. So that is included in here. And that would be pursuant to a state protocol. So we would work with BDH to have that. Section 14 also expands pharmacist prescribing authority in the practice of clinical pharmacy to test and prescribe drugs for treatment of COVID-19, flu, and strep. And this has been part of the rural health transformation grant process. So test and treat for these 3 limited conditions, COVID, strep, and flu was also included. So that's in section 14B. And then you'll see in section 14C, we wanted to make sure that pharmacy technicians would be able to do the testing that's permitted in 14B. So that just adds the testing. And pharmacy technicians are doing that testing when a licensed pharmacist is on site available to assist. So there are guardrails around when they can do that. Section 15, psychologists. So you may have heard that we're kind of engaged in a mental health licensure reform process. We've done a mental health licensure study that was 2 years in the making. It included psychology. And basically the point of that study was to identify barriers to licensure in mental health and to streamline our processes because we need more mental health practitioners in the state. So we engaged in that work. We're going to be coming next year with some proposed legislation to do that streamlining and reform work in our statutes. But until then, in the field of psychology, there is really strict rules around post-degree supplementation of coursework. So very limited opportunities if you've earned your master's or doctorate in psychology to supplement coursework to meet the exact requirements for licensure through OPR. And so if you miss, 3 courses that add up to 9 hours, you may have to go back and start completely over if you want a license from us. And we've had a couple of petitions from people who have been through educational programs who would be perfectly competent and safe to practice, where we could not deviate and issue that license. So they petitioned us to actually engage in rulemaking, which we will be doing after our statutory reform next session. But in the meantime, we have this section 15, which allows OPR to consult with the Board of Psychological Examiners and through policy allow for greater flexibility for master's and doctoral degree applicants to supplement that coursework if it's needed. So this is just kind of a fix in the meantime, and you'll see that this authority expires after a couple of years. So this is just a fix until we can get that statutory reform completed. Next section, section 16, midwives. So the first changes that you will see is that we are eliminating this advisory committee. So midwives are an advisor profession at OPR. That means there's no board. We engage with advisors to provide us with subject matter expertise when we're doing rulemaking or in our enforcement cases. When we get a midwife case, we use those advisors to help us assess that case and decide, should we charge this person or is this not a problem? But we have, in addition to that, an advisory committee that required reporting to OPR and to the Commissioner of Health. And it's kind of born, I think, out of distrust of midwives when this profession was first onboarded. So this advisory committee is supposed to have physician members also. And I'll just say that it's been really difficult for us to fill the seats on this advisory committee. It hasn't really been a functional committee in some time, and really hasn't been of value. So we would like to eliminate that. We will still have advisors, just like we do in any other advisor profession. And so this was also a little bit duplicative of what the advisors do, which is provide us with subject matter expertise. Okay. So we'd like to eliminate that.
That was really helpful. Thank you.
Yeah, no problem. And then still in section 16, I believe.
I think we can.
Are you good with midwives? Do you have any other questions about midwives?
I don't think so.
Okay.
No.
Because this does the main other changes for renewals. We're just saying midwives have to maintain a current certification with the national organization that certifies midwives. So they just have to maintain that. Next section, section 17, we're doing a sunrise report for speech language pathologist assistants. We're happy to do that. And actually that report is in process already.
So we get to 17, which is.
Oh, good.
It's here.
Excellent. Ready to, yes, talk about massage therapists. Is that what we have questions about?
Oh, there's fees in here, right?
Okay. So yes, there are fees in here. So what we're doing this session, or just to remind you, actually, massage therapists are a registration. It is not a license. A registration is something that requires no qualification for. And we studied whether massage therapists should be registered or licensed. We've done multiple Sunrise studies on this, and we've determined multiple times that registration appropriately protects the public. Because really, the concern that we have in massage therapy is human trafficking and sexual misconduct. And so we don't get complaints about massage therapists giving a bad massage and hurting someone. If we did see a lot of complaints like that, and if there was a ton of national data around that, then that might say people need to be more qualified to do this. But we don't see that. What we see is in our enforcement data that we have shows that we're getting sexual misconduct complaints. And so we address those. We've removed practitioners from practice, and registration is working just fine in massage therapy. This chapter, or these changes, regulate establishments now. So now we're registering establishments. And the reason we're doing this again is to have another tool in the toolbox to fight human trafficking. So this gives us authority to inspect massage therapy establishments, and it requires massage therapy establishments to provide us with business registrations and you know who their principals are and information so that we know who's operating this establishment. And again, tool in human trafficking, combating human trafficking. So the fees for massage. So the regular fee for registration is $100 for an initial fee, and that's set out in BSA 125. I just turn. Actually, I'm going a little bit out of order, and I don't want to confuse you all.
18A is fees.
Okay, 18. Yes, 18A fee. Great. So for registrations, the initial fee for registration is $100 in any profession. That's what the fee for an establishment is. And the renewal fee is $275. And that's the normal fee for any renewal of a registration. Now, we heard testimony in House Ways and Means from a practitioner about husband and wife practitioners and practices that have only 2 people, and kind of how the burden of those licensure fees might kind of disproportionately impact establishments with only 2 people. So in Ways and Means, there was a change, or on the House side, there was a change to reduce the fee for practices with only 2 professionals from $100 to $50. That's the initial fee. And then the renewal fee would go from, instead of being $275, it would be $75. And so that's for practices with only 2 people. If you're a solo practitioner, you do not have to register as an establishment. Okay, so really the establishment registration is for 2 people or more, and if it's 2 people, you're going to get a reduced fee. We good on that?
Yeah.
Okay, great.
Good. So is this common in other states that they're starting to register sites too, because it's proven efficacy to address the concerns that you've been hearing?
That's a great question. I think other states, you know, human trafficking is prevalent in every single state. And we're all grappling with how can we get tools in the toolbox. So I do think establishment registration is something that's happening elsewhere. And
It's been an issue in Vermont.
Yes, I think we're gonna do this one. Yeah, you might do 2 more.
You don't have this one warned for a vote today, but. Happy to.
this,
Do we have to warn it for vote? I don't think so.
Best practice is to update it when you think it's gonna happen.
Good vote. It's updated.
Refresh your screens, everyone.
did y'all have any?
It is
Did y'all,
the end of the session.
did y'all want me to continue, Dr. Bill, or with that? Did I really answer all your questions?
There's
Really?
Yeah, that is helpful.
Okay.
I'm looking at the There's a couple fee changes in here, I think.
Well, part of the
Special
confusion,
endorsement of existing license, $100.
we had some fees that were in an incorrect section of our fee bill in 3 VSA 125. So we had to move several of those from section B into section A. So that was, I think, the confusion earlier. So the only new fees in here relate to massage therapy establishments. That initial registration fee is $100. The registration fee is already in there. But we had that special reduced fee for practices with only 2 people.
Okay.
So that's really the only
Thing,
fee
everything
in
else.
there.
Okay.
That's right.
Except for the 0 fee.
Except for the 0 fee
Yes.
and then whatever savings we're gonna get from this midwife advisory committee being.
Well, if it hasn't
Going away.
met, you're not gonna get any
Exactly.
savings for not meeting.
Yeah.
Okay. Committee. Questions, what's your pleasure? You feel ready to vote on this one, or would you rather let it percolate? Ready.
I'll move that we approve H 588 draft 4.1 as recommended by the Senate government as amended and recommended by the Senate government operations.
Okay, Senator Hardy has moved that we approve. We'll bring it up to the top. H588, and it was sent to us by the Government Operations Committee. Is there further discussion? If any amendment? If not, all those in favor say aye.
Aye.
Opposed say no. That's 700, and you can put a check next to everyone's name. Okay, thank you, committee.
I can report it if you want.
Yes, that would be great. Okay. And that one is out. And we've done 77, which gets us to the bottom of the page. The first one is 753, which is, we've got 2 of them up there. I'm getting emails on 753 now. I don't know. I don't know who's put the call out because the calls are coming in and I'm getting cards. Yeah, here's what, please pass H 753 out of committee.
Oh, you're getting that.
I'm getting that. I've gotten several. This is 753. This is the one, we had one in here, we didn't do it. Basically tells the PUC and the utilities to do what they're doing, which is not disconnecting your electricity during a heat wave, a heat advisory. If I can find a copy of it.
I thought I remember hearing from the PUC or the
They
utilities. They would like
don't
to
think
adopt.
it's necessary, I believe was,
The thing I keep hearing from the utilities is that anything that we do that allows people to get further and further behind
Yeah.
it doesn't end up well.
we did hear that, and we heard that they work very hard to keep people from getting disconnected. That's what I
Right.
want to make sure. I don't think this, it asked for a study. But I don't think anything really bad is going to happen if it doesn't come out. So maybe we'll put this off till next week. And I have a small amendment to the rest also. Did this one? Yeah. Okay. So the other one,
Yeah.
as people are here, we might be able to get out of this H 385, which is probably a little fresher in our memories. That is coerced debt. Okay, we do have 753 on our website, so we can take a look at that. This
That's
is,
753 that you're just on.
oh,
Wait, 753 is the core step, right?
no,
No.
rates.
Keep
Rate,
going.
that's what there's this. Okay.
Okay, let's give ourselves then time to work on this and we'll get Maria in. We've got an amendment. The other one is up there is the coerced debt. We did that yesterday. I've got people in the room. It sounded like this was democracy at its best. Everybody went to the hall. Everybody gave a little, everybody got a little. And there is not complete comfort on any side. But everyone thinks this is worth giving it a try. And it basically would set the parameters for how someone could have coerced debt forgiven short of going to court, which they'd have to do now. And it also would allow financial institutions to put a hold on suspicious transactions. Yeah, that one, there didn't seem to be any controversy over. Are we comfortable enough to move that one, or would you rather?
I make a motion.
I'm good.
Yeah, I move that we approve that we concur with H385.
Okay. Concur approve page 385 as it was sent to us. Come from Health and Welfare.
Judiciary had it. and they-
Judiciary, that's right.
They just
They
released it.
looked at their
So
two sections that had to do with the court and released it to us. So it's as it came to us, and they, I don't believe amended it. It's as it came from the House. That's right.
it's not passed by House, we're concurring.
All right, so this is as passed by House. Is there further discussion? Senator Hardy has moved. Any further amendments? If not, all those in favor say aye. Opposed say no. I'm not hearing any no's, so I'm gonna call it 700. Okay, who would like to report this one? You want to do it? Okay. Yes, you do. No, I have a feeling I am up to my eyeballs in committees of conference.
I did not already agreed it for including this one, but will it go to approach or anything?
No,
No, so it'll be, all right, Wednesday.
Still okay for board.
Sure, unless you really want it.
I mean, if you don't want to do it, I'll do it, Martine, if you have other things, but if you don't, if you can, you have any next week? I have, 2 bills next week so far.
On Tuesday?
Probably on Wednesday, but, I'm happy to do it. I'm sure I can get, an outline from somebody that will make it easier. You go or you don't have too much.
Why don't you? Because I do have a lot.
Okay, if you want to put me on that.
Committee,
Change that.
we have finished, I think, no, I have more,
No, I think
That's all.
No. nothing on the back. We have finished our work. It is 3:30.
Bravo.
We are getting out of here before 6 o'clock.